Chapter 5: Moral Status. Today, we turn our attention to one of the most critical and, at times, controversial topics in healthcare ethics: moral status. Understanding moral status is foundational because it determines who or what deserves moral consideration, and how much weight we give to their interests when making ethical decisions. It shapes everything from our approach to patient care to our stance on animal research, emerging technologies, and even artificial intelligence. 1. Defining moral status. In bioethics, moral status refers to the degree of moral consideration owed to an entity. It's the answer to the question, who counts morally and why? It is not simply a theoretical question. It directly impacts policymaking, clinical decisions, and societal norms. For example, if a fetus is granted full moral status, then abortion is seen as the taking of a human life. If certain animals are granted partial or full moral status, then their use in research becomes ethically restricted. Even in the world of technology, if an advanced AI system were to possess sentience, some argue that it too should be afforded moral protections. 2. Western philosophical approaches. A dominant perspective in Western moral philosophy grounds moral status in rationality, autonomy, and agency. Thinkers in this tradition, like Immanuel Kant, argue that rational beings have intrinsic worth and should never be treated merely as a means to an end. From this perspective, moral status is often linked to cognitive capacities, the ability to reason logically, the capacity to make moral choices, the potential for self-awareness. This is why, in many legal and medical systems, adult human beings are automatically afforded full moral status. However, even within Western philosophy, there are tensions. What about individuals with profound cognitive impairments? What about newborn infants who do not yet demonstrate rationality or autonomy? These cases push us to question whether rational capacity should be the sole determinant of moral status. 3. Cross-cultural perspectives. While Western frameworks tend to emphasize individual reasoning, other cultures may base moral status on different principles. For example, African communitarian ethics may view moral status as arising from one's embeddedness in a social community. Certain indigenous traditions extend moral concern to all living things, not only rational beings, because of the interconnectedness of life. In Eastern philosophies, sentience, or the capacity to suffer, may take precedence over rationality when determining moral worth. This cultural diversity reminds us that there is no single universally accepted formula for determining moral status. As healthcare providers, we must remain sensitive to these different perspectives when serving patients from varied backgrounds. 4. Moral status and emerging science. New technologies are forcing us to rethink long-held assumptions about moral status. Consider chimeric beings, organisms composed of cells from 2 or more species. Some bioengineers are creating animals with human stem cells to study disease and develop treatments. Do these hybrid beings have the same moral status as regular animals or something more because of their human components? There is no consensus. Some argue they should have enhanced protections. Others insist they remain primarily animals in moral terms. Similarly, advancements in artificial intelligence and synthetic biology raise unsettling questions. If an AI system demonstrated consciousness, should it be treated as a moral subject? Could robots one day have rights? 5. The role of empathy and moral sensitivity. Beyond philosophical reasoning, moral status is often shaped by empathy, our ability to emotionally connect with the experiences of others. Healthcare professionals who cultivate empathy can better appreciate the perspectives of patients, including those who are vulnerable or marginalized. This is where moral sensitivity comes in, the ability to recognize when a situation has ethical dimensions. Empathy fuels moral sensitivity, and together they guide ethical decision-making. For example, a physician might logically know that a patient's autonomy should be respected, but empathy enables them to understand the depth of the patient's fear or hope. This richer understanding can lead to more compassionate, morally sound decisions. 6. Human dignity and moral status. The concept of human dignity is inseparable from moral status. Human dignity asserts that every human life has inherent worth and should be treated with respect. This principle is enshrined in international human rights declarations and is a cornerstone of medical ethics. In practice, this means that even individuals who cannot advocate for themselves, such as those in comas with severe dementia or newborn infants, must still be treated with care and respect, not merely as biological organisms, but as beings with intrinsic value. 7. Sentience as a criterion. Some ethicists argue that the capacity for sentience, to feel pain and experience pleasure, is the most important criterion for moral status. From this standpoint, many non-human animals deserve significant moral consideration because they can suffer. This view has major implications for how we treat animals in medical research, food production, and even environmental policy. For example, if pigs and chimpanzees are sentient, then ethical frameworks must address whether it is morally acceptable to use them for experimentation, especially if the harm outweighs the potential human benefit. 8. Feminist bioethics and marginalized voices. Feminist bioethics challenges traditional moral status frameworks for ignoring the lived experiences of marginalized groups, especially women, but also racial minorities, people with disabilities, and those in poverty. This perspective emphasizes that power imbalances shape whose moral status is acknowledged in practice. It warns against abstract definitions that fail to protect vulnerable populations in real-world healthcare systems. Feminist bioethics insists on listening to diverse voices when defining moral status and crafting ethical policy. 9. Rationality and bioethics in practice. Rationalist approaches often dominate hospital ethics committees, research review boards, and policy making. They emphasize consistent application of ethical principles, fairness, and justifiable decision making. For example, during the COVID-19 pandemic, when ventilators were scarce, many institutions developed triage protocols rooted in rational assessment, prioritizing those most likely to survive and benefit from treatment. While rationality promotes fairness, it must be balanced with compassion and sensitivity to individual circumstances. Without that balance, decisions can feel cold or dehumanizing to patients and families. 10. Moral agency. Moral agency, the capacity to make moral decisions and take responsibility for them, is another factor in determining moral status. In healthcare, recognizing a patient's moral agency means involving them in decision-making to the greatest extent possible. For example, even if a patient is severely ill, they may still have the capacity to express preferences about their care. Respecting their input affirms their dignity and recognizes their moral standing as an agent in their own life. 11. Practical implications in healthcare. Moral status influences many day-to-day healthcare decisions. End-of-life care. Deciding when to withdraw life support involves weighing the patient's moral status alongside their wishes and prognosis. Animal research. Determining whether to conduct experiments on animals requires evaluating their capacity for suffering and our obligations toward them. Treatment of embryos and fetuses. Policies on IVF, abortion, and stem cell research hinge on whether these entities are seen as possessing moral status. Artificial intelligence in diagnosis. As AI takes on greater decision-making roles, we must ask whether these systems are mere tools or entities with moral relevance. 12. Key ethical tensions. When assessing moral status, we face recurring tensions: universalism versus cultural relativism. Should there be one universal standard for moral status, or should it vary by culture? Capacity versus membership. Is moral status about what an entity can do, think, feel, decide, or simply about what it is, a member of the human species? Equality versus gradation. Should all beings with moral status be treated equally, or are there degrees of moral standing? These tensions explain why moral status debates are often so polarized. 13. Discussion scenarios. The textbook offers scenarios that bring moral status debates to life. Sentience and animal rights. If a research law required all sentient animals to receive legal protection, many laboratories would have to radically alter their practices. Emergentism and robot rights. If robots demonstrate consciousness through emergent behavior, should they be moral agents? Moral agency in autonomous vehicles. If a self-driving car faces a crash decision, should it prioritize passengers or pedestrians? What moral status does each party have in that instant? These scenarios challenge us to apply moral status theory to concrete, often urgent, ethical dilemmas. 14. Closing reflections. In healthcare ethics, the question of moral status is not abstract philosophy. It directly affects how we treat patients, design research, and legislate medical practice. As science advances, the boundaries of moral status are likely to keep expanding and shifting. For the healthcare professional, the challenge is to navigate these evolving questions with a balance of rationality, empathy, respect for dignity, and cultural awareness. By doing so, we not only uphold the highest ethical standards, but also honor the humanity, and in some cases, the sentience of all those in our care.